So what are three medications you should definitely tell your neurosurgeon about before you have any type of brain or spine surgery? Number one is always blood thinners. Blood thinners increase the risk of bleeding in any type of surgical procedure. And in the brain and spine, this is critical because hemostasis, or the ability to stop bleeding, is absolutely critical to safely do the case. Drugs where you can actively monitor the amount of the concentration in the blood are generally preferred over blood thinners where you can't monitor. And that's the reason typically when someone has to be on blood thinners before surgery, we prefer things like heparin or Coumadin where you can actively monitor them as opposed to low molecular weight heparins or drugs like Brilinta, which are often very difficult to monitor during surgery. Number two are immunosuppressants and steroid medications. Now, there are certain cases, particularly with brain tumors, where we prescribe steroid medications before to help with swelling. With pituitary tumors, we do this also because the pituitary gland itself might get shocked during surgery, which would affect its ability to produce cortisol and other hormones. But generally speaking, steroid medications, particularly in cases of rheumatoid arthritis, immunosuppressants, drugs related to cancer and other things, can affect wound healing. They can increase the risk of infection and delayed wound complications. Additionally, in certain types of spinal fusions, it can increase the risk of failure with respect to fusion. Finally, drugs that raise the blood pressure are extremely important to tell your surgeon about. Drugs like midodrine, drugs like amphetamines, medications like that can raise the blood pressure, particularly when you're doing vascular surgical procedures. This can increase the risk of bleeding. It can increase the risk of aneurysmal rupture as well during aneurysm surgery. So those are important drugs to tell your surgeon and your anesthesiologist about prior to surgery, and in some cases those medications may need to be stopped or modified. And of course, any type of illicit drug use should be disclosed as well. Personally, one of the toughest cases I've ever dealt with postoperatively is a patient who underwent elective spine surgery who didn't disclose that he had taken cocaine the night before, and a fairly routine surgery where he should have gone home the next day ended up being a 2-week ordeal in the hospital, and the patient almost died from it. So it's absolutely critical to let your physician know about these situations, and in some cases this may require rescheduling the surgery or further optimizing your care before the surgery.